Understanding chemotherapy, a powerful weapon against cancer. Chemotherapy is a type of cancer treatment. It uses powerful drugs to kill cancer cells. These drugs work throughout the body. Chemotherapy is often used with other treatments like surgery or radiation. It is a cornerstone of modern cancer care. Chemotherapy has been used for several decades. It has played a crucial role in increasing survival rates. Many different types of cancers are treated with chemotherapy. It remains a vital tool for doctors and patients alike. The goal of chemotherapy is to stop cancer growth. It aims to either destroy cancer cells or prevent them from multiplying. Chemotherapy is a systemic treatment. This means it can reach cancer cells throughout the body. Chemotherapy is a complex treatment modality. Understanding its mechanisms and effects is important for patients. This knowledge empowers them to actively participate in their care. How chemotherapy works: targeting rapidly dividing cells. Chemotherapy drugs target cells that divide quickly. Cancer cells divide rapidly, making them vulnerable. These drugs disrupt the processes cells need to grow and multiply. This either kills the cancer cells or slows their growth. Healthy cells also divide, but not as quickly as cancer cells. This difference in division rate is what chemotherapy exploits. However, the drugs can still affect some healthy cells. This leads to side effects. Different chemotherapy drugs work in different ways. Some damage the DNA of cancer cells, preventing them from replicating. Others interfere with the proteins needed for cell division. The choice of chemotherapy drugs depends on several factors. These include the type and stage of cancer, the patient's overall health, and previous treatments. Managing side effects, a necessary part of the journey. Chemotherapy can cause side effects because it affects rapidly dividing healthy cells. These side effects vary from person to person. They depend on the type and dose of chemotherapy drugs used. Common side effects include nausea, vomiting, hair loss, fatigue, and an increased risk of infections. These side effects are usually temporary and subside after treatment ends. Doctors can prescribe medications and recommend lifestyle changes to manage side effects. Antiemetic drugs can help with nausea and vomiting. Medications can also boost blood cell counts and reduce the risk of infections. Patients are encouraged to maintain a healthy diet, stay hydrated, and get enough rest. Support groups and counseling can also provide emotional support. Section 4. The chemotherapy experience. What to expect during treatment. Chemotherapy can be administered in different ways. The most common method is through an intravenous infusion. This involves injecting the drugs directly into a vein. Chemotherapy is typically given in cycles. Each cycle is followed by a rest period to allow the body to recover. The duration of each cycle and the number of cycles vary depending on the treatment plan. Before each chemotherapy session, patients usually undergo blood tests. These tests monitor blood cell counts and liver and kidney function. During the infusion, patients can relax, read, watch TV, or talk to loved ones. Nurses closely monitor patients for any adverse reactions. Section 5. Hope and progress, advances in chemotherapy and success rates. Chemotherapy has significantly improved cancer survival rates over the years. Advances in research have led to the development of new drugs and treatment strategies. Targeted therapies are a newer type of chemotherapy that specifically targets cancer cells. These therapies have fewer side effects than traditional chemotherapy. Immunotherapy is another promising area of cancer treatment. It uses the body's immune system to fight cancer cells. Immunotherapy has shown remarkable success in treating certain types of cancer. Chemotherapy continues to evolve, offering hope to countless cancer patients. With ongoing research and advancements in treatment, the future of cancer care looks promising.